I'm Krista Courtney, and this is your Quality and Safety Snippet for February 27th. Registered nurses and hospitalists at ORMC are using a best practice borrowed from airline pilots by rounding with a new and innovative checklist that's focused on quality and safety components of patient care. Just as a pilot and a co-pilot go over checklists before takeoff, the registered nurse and physician are reviewing a standardized checklist of common hospital-associated risk factors at the patient's bedside before leaving the room during morning rounds.
One of the core values in our Orlando Health nursing professional practice model is collaboration. The collaborative rounding checklist is a tool that we're using to facilitate physician and nursing rounding on patients. And how it's used is that when a physician comes to see a patient, he and the nurse will round on the patient together and use the checklist as a way to make sure that they achieve all of the quality goals and needs for the patient.
We've modeled the standardized rounding checklist similar to what pilots use when they fly. I flew for several years, a private airplane, and all pilot students learn from the first lesson the importance of using a standard checklist each and every time they fly. When you don't use a checklist or don't use it as designed, you tend to forget the minor details.
A checklist ensures quality, it's a best practice, and it's proven to work in many different fields, and it's going to work for collaborative rounding and ensuring patients get quality care every day that they're here at Orlando Health.
The patient checklist improves patient care and also efficiency, and it also makes the patient feel more involved in their own care. Most of all, it improves communication and camaraderie amongst all that are involved.
Having the doctor, the nurse, and the patient there at the bedside, if I have any questions about any of the orders that he wants to put in, or if I need any of the patient's pain issues or anything like that addressed, I have the doctor there. It's streamlining our care. It's making our care a lot faster. It's reducing the amount of calls that I have to make to physicians, and it just makes everything a lot easier.
The rounding checklist is being piloted at ORMC before rolling out to areas throughout the organization. That's it for today's Quality and Safety Snippet. Another episode will be coming your way in a couple of weeks.